Hi, my name is Jaaurrie. On behalf of the Department of Management and Healthcare Administration, this presentation will focus on burnout syndrome implications in the nursing environment. The table of contents are as follows. Beginning with a summary of the research that was found, we would transition to the purpose of the study, followed by supporting information, which will ultimately close out with how the data on burnout can make a difference in the world of healthcare. Nurses are essential workers in the healthcare field. Individuals in this sector who work in critical care environments are often subjected to experiencing burnout syndrome. Burnout occurs as a result of someone being overworked and exposed to constant physical, mental, and emotional stress. As a result of having to work in these types of conditions, nurses are more susceptible to committing unnecessary medical errors and gaining a decrease in the satisfaction of their job. The aim of this presentation is to provide a better understanding of nurse burnout by using a process model replication, which shows burnout leading to turnover intentions. The motive of the study is to show the effects that burnout have on registered nurses. Nurses make up a large portion of the healthcare sector, which therefore deems them to be of great importance. It is crucial to understand how burnout plays a role in the lives of nurses. With them being put under constant pressure, the symptoms of burnout are affecting the mindset and performance of their job. If nurses begin to fall victim to burnout syndrome, the number of nursing staff will begin to decline in the near future. Burnout syndrome is something that affects the emotional, mental, and physical state all at once. Prolonged stress in the work environment can contribute to individuals feeling exhaustion in all three of these areas at one time. Stress is something that plays a big role in burnout and is essentially a feeling of being overwhelmed with pressure or having a sense of being unable to cope. Emotional exhaustion is one of the three contributing factors of burnout, which can be defined as going through a state of feeling emotionally worn out due to stress being built up from one's personal life and/or their place of work. The next factor that contributes to burnout is physical exhaustion. This occurs as a result of an individual being physically overworked, which can lead them to feeling fatigued as well as physically drained. The last contributing factor of burnout is mental exhaustion, which can best be defined as being put through continuous cognitive activity. It can make a person feel overwhelmed as well as make it seem as though their problems are impossible to overcome. The question that was composed for the sake of research was whether or not burnout syndrome posed as a real issue for nurses and whether or not it had an impact on the quality of care that they give their patients. Some hypotheses were able to be formed from this question in order to provide an insight on my research expectations before actual data was collected. Based upon an educated guess, the hypothesis formed centered around emotional exhaustion, depersonalization, and turnover intention. The three hypotheses formed were: emotional exhaustion in nurses is positively related to turnover intention. Emotional exhaustion in nurses is positively related to depersonalization of patient care. And depersonalization in nurses is positively related to turnover intentions. A side note that I would like to throw in here is that the method I was originally going about to collect data was suddenly brought to a stop on March 9, 2020 due to the COVID-19 virus pandemic. This resulted in me having to subject to using replication as my only usable method in order to ensure that the study was to be completed on time. On account of this, the research presented withdraws to present its findings in VSU's undergraduate research journal or any other professional or academic outlet outside the VSU Undergraduate Research Symposium. With that being said, the method used to conduct this research consisted primarily of data collected by a third party. They carried out opinion surveys from employees and allowed for the use of the information for the sake of study replication. I trust the data used by this individual, seeing as though it doesn't include any information that was personally identifiable and it fit well with the replication guidelines. Results from the employee surveys showed that out of approximately 900 registered nurses, a total of 340, or 37.7%, responded to and completed the survey. Here you can see the results from the data collected by the third party. The important categories to take note of are CFI, SRMR, and RMSEA. CFI, or Comparative Fit Index, analyzes the model fit of a hypothesized model with that of a baseline model. Well-fitting models have a CFI that is greater than 0.90, and by looking at these results, you can see that a CFI of 0.93 is found in relation to the measurement model of 3 factors. SRMR, also known as Standardized Root Mean Square Residual, is an average of the residuals between the observed and implied covariance matrix. A value of 0 would indicate a perfect fit, and a value less than 0.08 is generally considered a good fit. Results from this slide show that an SRMR value of 0.06 was identified in the model with 3 factors. The last important category is RMSEA. RMSEA, or Root Mean Square Error of Approximation, avoids issues of sample size by analyzing the discrepancy between the hypothesized model, with ultimately chosen parameter estimates, and the population covariance index. The range of RMSEA ranges from 0 to 1, with smaller values indicating better model fit. According to the chart, numbers with the lowest values of 0.07 and 0.08 resided with the measurement model of 3 factors. Moving along to part 2 of the results, the sample shows that there was a total of 340 nurses that participated in the survey. On the far left side of the chart, you'll see all the variables that had a factor in the research. However, the 3 factors to take note of here are emotional exhaustion, depersonalization, and turnover intentions. The other variables are mere measurement variables. Looking at the chart, you'll also notice specific numbers are either italicized and underlined or in bold print. Those that are italicized and underlined represent values that are less than 0.05, which means they are statistically significant and indicate strong evidence against the null hypothesis. The values in bold are numbers that are less than 0.01, which represent the fact that there is substantial evidence against the null hypothesis. What can be implied from all the data that has been collected is that burnout is in fact a component in predicting turnover intention. While nurses are being exposed to situations and environments that increase their state of emotional exhaustion, they begin to harbor feelings of dissatisfaction and negativity, which eventually leads them to exhibit this behavior towards the patients they're caring for. Healthcare organizations can work to reduce turnover intentions with their nursing staff by paying closer attention to the signs and symptoms of burnouts and taking effective measures to ensure that they maintain statuses on the wellness of their employees in order to decrease the chances of a burnout occurring within their workplace. The limitations in this research reside under the fact that it concentrates solely on the effects of emotional exhaustion in nurses on turnover intentions, without taking into account the effects of potentially mitigating variables. Research that will be done in the future should closer examine changes in behavioral performance regarding emotional exhaustion, depersonalization, and turnover intentions through repeated steps over different time frames to build trust in deductions of causality. With burnout continuing to affect the nursing community, it can be foreseen that a shortage of nurses will be an issue in the near future, in addition to the continuous rise of the cost of nursing turnover. Thus, it is of great significance that healthcare organizations begin to understand the role of burnout on nurses and its effects on turnover intentions. The presentation finishes with an appendix of CFA model fit definitions, which were explained earlier in the PowerPoint to give a better understanding of the results found from the survey data. Thank you for your time. This concludes the presentation.